Hello, welcome to the Value of Colonoscopy discussions. I'm Jonathan Cohen, clinical professor of medicine at NYU Langone Health, and I'm here on behalf of the ASGE, Value of Colonoscopy, to talk with my friend and colleague at NYU, Dr. Peter Liang. Peter is an excellent researcher in colorectal cancer, and he's published a recent article this November in Clinical Gastroenterology on the risk factors for early onset colorectal cancer. So thank you, Peter, for joining us tonight. And I'd like to start by asking you to tell us a little bit more about those risk factors, apart from family history, that you've found to be associated with early onset colorectal cancer.
Yeah, I mean, I think you're saying with respect to some of the risk factors that we found.
Yes. So say your patient is 45 years old, has a grandparent with adenocarcinoma, and is African American. How does that influence your discussion with the patient about what screening to obtain?
Yeah, so that's a really good question. I think, I'm someone who, obviously, I do the primary research. I'm really interested in evidence, and I'm, definitely stand by. I'm really proud of what we, of our study. That said, it is a single study. And I think it's probably premature to just kind of risk stratify based on our study alone. And I think there's going to need to be additional studies to hopefully replicate that, and then figure out if there's a role to more formally kind of establish risk scores to risk stratify people by some of the risk factors that we found, or potentially other ones. So for right now, I don't think, I would, based on, say, a race ethnicity, I would, think more about telling individuals to screen with different modalities or start screening it earlier. So for now, I think I would treat everyone still the same, other than the things that we know about, like the family history and inflammatory bowel disease and such. But, hopefully, with more data, more time, we will be able to, figure out more nuanced ways to risk stratify people, and think about, is it better to, in terms of, resource utilization, do we need to do colonoscopy on everyone? Can we perhaps do flex sig? Can we perhaps, have different kind of algorithms for dealing with different people based on risk stratification?
That's very interesting. I want to turn the discussion a little bit to your thoughts as to whether the data that you've put together on risk factors for early onset colon cancer may have some potential role in reducing barriers to screening among some of these high-risk groups. There's a lot of attention on early onset cancer, and I wonder whether or not you have any thoughts about how information about increased risk factors might be applied in discussions with patients at some point, either now or when more corroborative data is available to identify who really is at higher risk. What do you think?
Yeah, absolutely. I think that certainly is the hope. I think with anything, in terms of research, ultimately what we want to do is to be able to spread the message, right? Tell everyone, and tell the people who that research is hopefully going to impact and improve their lives, that this is the most current evidence, and we think that, for your own health, you should perhaps screen earlier. Again, I think at this point, we're not kind of there yet in terms of having a changing the clinical management for specific types of people, because I think that's still a little bit premature. But certainly, once we accumulate more evidence and be able to put out, guidelines and things like that, then it's really upon all of us as clinicians who see patients, or public health professionals, to really disseminate that message and then implement it in our practices. I think I've all heard that even when guidelines come out, and guidelines, this is many years after the primary research. After guidelines come out, it takes many years for it to be implemented into practice, and that's often too slow. So I think you're right. I mean, I think there's certainly been a lot of attention on this condition recently, with the unfortunate passing of Chadwick Boseman and other folks, right, and a lot of other less famous folks who've been affected. But so I think we should use that momentum to learn more about this condition, and hopefully find the right strategies to combat it.
Well, Peter, I think that your excellent work is going to definitely help, and through the Value of Colonoscopy campaign and others, to try and get the word out about this. I think we're going to make a lot of progress in that regard. But I want to turn now, Peter, tell us what's next. What's your next on your plate for investigation in this area?
Yeah, so I mean, with regard to early onset colorectal cancer, we're still doing a lot of other projects to looking at other data sets to figure out if there are, besides the things that we can find in the medical record, right? We think about these are people probably maybe have had some type of exposure when they're much younger, and that wouldn't you wouldn't find that in EPIC, right? But so looking at some data sets that have asked about exposures when individuals in their childhood, or even kind of around birth, related those types of things, to see if there are ways to risk stratify based on that. And then just in terms of other kind of questions, I'm also really interested in figuring out what's the kind of the optimal way to screen and surveil people for colorectal cancer screening, because obviously, as we've talked about, there's a bunch of different tests that we can do to long term, what is the optimal kind of screening and surveillance strategy? I think it's also a really kind of interesting problem to look into. So lots of different questions, but slowly trying to make progress in all of those.
Well, Peter, I want to thank you so much for taking the time to share with us your insights and the information you've put together through your great work that you're doing, and just help support the Value of Colonoscopy campaign in this way.
Well, thank you so much. It was a pleasure being here, and anytime. So thank you.
So on behalf of the ASGE Value of Colonoscopy campaign, thank you for joining me with Peter Liang from NYU this evening, and we look forward to seeing you soon.